Hey everybody, welcome back to another video. Today I want to do a very quick video talking about breastfeeding. I'm doing this video for all the new moms who might be having challenges with their breastfeeding, and I want to give you some tips and tricks on things that can make your breastfeeding journey a lot more smoother. Okay, and this will also apply to people who are still pregnant and who have not yet given birth, because these things are very important, guys, to implement from the day you give birth to ensure that nothing can stop you from breastfeeding your baby. Okay, so the first thing that is very important, you guys, is to get the baby on the breast as soon as possible after you give birth. And preferably this should be within the first hour after your baby is born. So if you give birth naturally, that is perfect, because it puts you at a good position to be able to do this from the get-go. So after you give birth naturally, that is, your baby is going to be put on your chest and skin to skin is going to be started. So that skin to skin, it sets the tone and it just creates the perfect setting for your baby to start breastfeeding. If you give birth via a cesarean section, there might be some separation between you and your baby, depending on the hospital where you give birth at, or whether you have a midwife with you present. But if you do have a cesarean section, the best thing to do would be that after you give birth, your baby is put skin to skin on top of your chest, and that you stay with your baby throughout the time up until you go back to the ward. So that would mean that your baby is staying skin to skin with you while you're in theater, and then when you are taken to the recovery room, your baby stays with you on your chest. Then when you are in the recovery room, then continue breastfeeding, or even start the breastfeeding and putting the baby on the breast. That would be the best thing to do, you guys, because straight after birth, your body can be stimulated and your body can know that it needs to make breast milk for your baby. So that's tip number one, very, very important. Try and get your baby to feed as early as possible, preferably within the first hour after birth. One thing that's very important, you guys, to be done, and especially like after that first feed, is to squeeze the nipple and to see how much colostrum you have. So some moms from the get-go, they don't have any colostrum at all. No matter how much the midwife tries to squeeze, there's nothing coming out. Those moms need to get medication to help the colostrum to come. And also, if you do notice that you are those moms who don't have like anything coming out at all from the get-go, put the baby on the breast. Put the baby on the breast, get the baby to suck on your breast. The more the baby sucks on the breast, the more it sends a message to the brain to make milk. Okay, so some moms, whereby when you squeeze before the feed, nothing comes out. If the baby is put on the breast and sucks for a good amount of time, and 5 minutes is not a good amount of time, you guys, you need to put that baby on the breast at least for 20 minutes on one breast, 20 minutes on the other breast. Then that will really stimulate the breast to produce breast milk. So that's very, very important. If you know, or you can see that your milk is not coming out, and get your midwife to come and squeeze for you, because what I've seen is that moms, sometimes they do squeeze themselves, but nothing comes out because they don't have the technique on how to squeeze. So get your midwife to be the one to squeeze your breast for you and see if there's any colostrum coming out. Then, if you are amongst the other group of moms who have colostrum coming out when the breast is squeezed, please do not waste that colostrum, guys. Make sure that your baby stays on the breast sucking. The more the baby sucks, the more your body produces more milk. And one thing to keep in mind, in the first 3 days, your milk will not be coming out in huge amounts. Don't expect huge amounts of the colostrum. The volume of the colostrum is not a lot, but it's nutritious enough to take care of your baby's needs. So Another thing that we need to try and avoid very early in those first 3 days where you're having the colostrum is we need to try and avoid the urge to give that baby formula milk. So we want to tackle what is the problem and why is the milk not coming out. And if the milk is not coming out, we want to try and get the medication to try and get your body to produce milk instead of running straight to formula. And if we are going to give formula, we want to put the baby on the breast first. So this is very, very important, you guys, and this can mean whether you are going to breastfeed your baby or you're not going to breastfeed your baby. If your baby gets used to sucking on a bottle before your baby gets used to sucking on your breast, you might lose the battle with breastfeeding. So if you really with everything in you want to breastfeed your baby, the only thing that your baby should know is the shape and size of your nipple. That is it. No bottle teat. Do not get your baby used to sucking on a bottle. Even if you are struggling with breastfeeding and you absolutely have to give formula, give that baby formula with a cup. Those small medicine cups that are used in the hospital to give medication, get those cups for yourself before you go into hospital to give birth or the birthing center, wherever you're going to be birthing. Or get syringes, maybe like a 10 ml syringe that you can use instead if you cannot find a cup to feed your baby, whether you're going to be giving the formula in the first few days or whatever. So it's very crucial. What you do in those first 3 days is very crucial, and it sets the tone for your journey with breastfeeding. That baby needs to be on the breast immediately within an hour after birth, and you need to put the baby on the breast and get that baby to suck. So if the baby stops sucking, do not give up. Keep the baby on the breast. Try and squeeze an amount of colostrum from the breast and give that baby that amount. And also just try and squeeze the colostrum so the baby can taste it, so that you can try and encourage the baby. But guys, also, even if you are struggling with breast milk, you do not have to jump straight to formula feeding. Another thing that you can do is to start using a breast pump on your breast and trying to express some colostrum, and then rather give your baby that colostrum instead of giving the baby formula. And another thing that can be done also is to use a spoon and hand express on the spoon the colostrum, and you use a syringe to suck it up and give your baby the milk. There's just so many things that can be done than jumping straight to the formula and the bottle. But if you absolutely have to jump to the formula, especially in those first 3 days, try and ensure that you don't give the baby the formula with a bottle. The teat of the bottle is so much more easier to suck on than your nipple. So guys, without fail, your baby is going to prefer the teat over your breast, and it's gonna be very frustrating for you, and it's gonna be very frustrating for your baby now to try and undo what the brain has already gotten used to, which is sucking on the bottle teat compared to the breast. If your baby gets used to sucking on the teat of the bottle, you will find it very, very difficult to get that baby to suck on your nipple, especially if you're a person that really wants to breastfeed. So those are the tips and tricks. Obviously, things like your diet, eat a balanced diet, drink lots and lots of fluids, you guys. If you are dehydrated as the mom, you will not be able to make breast milk. But one thing about the breast milk is that after day 3, after you give birth, that's when your milk is going to start to come in. So as a mom, you just need to try and hang on for the first 3 days, and obviously you need to have a lot of support for this to happen. If you can just try and hang on for those first 3 days, once your milk starts to come in after day 3, then it becomes so much easier for you to just continue breastfeeding your baby. And you can even now give your baby only breast milk going forward and no more formula, because the volume now will be much more than it was in the first 3 days. Okay, so one last thing that I want to mention in this video that is really important, and that will determine your milk supply after your milk starts to come in, guys, is if you started topping up the baby with formula or giving formula feeds while you were in hospital, if you continue to give that baby formula, or the longer you give the baby formula, that means that the baby will have periods where the baby is not on your breast and not sucking on your breast. That will mean that that supply and demand cycle of your body making breast milk, because of the demand from the baby, that is going to go down. So that will mean that your body is not going to make as much milk now. When it sees that your baby is not feeding on your breast as much, or you're not even like using a breast pump to express, then your body is going to think that it doesn't need to make breast milk anymore, and the supply of the breast milk is going to go down. So very important. If you're going to give formula at the hospital, do not give the baby a full feed of formula. Rather do like a top up, maybe of 10 mils. Don't give the baby any more than that. Encourage the baby to be on the breast rather than to just give the formula. And then after your milk starts to come in, then stop giving the baby formula altogether. Because if you continue to give the baby formula, then your breast milk supply is going to go down, because your baby is going to have a full feed of formula, not be on the breast. If you're not expressing as well, you're not stimulating the breast, and you're not stimulating the brain to make more milk, to tell your body to make more milk. So that's very, very important. So yeah, those are the tips and tricks that I wanted to talk to you guys about in this video. And it's not a lot of time for me to talk about everything, but I really hope you're going to take these tips and they're going to come in handy for you. And I wish you all the best in your breastfeeding journey. See you on my next video. Bye.